Hello friends, welcome to my page. Myself Dr. Amardeep at your service once again. I wish you stay fit and fine. If you are new to my channel, please like and subscribe my channel. So let's start our video. Today we will discuss about a more grave and fatal disease happening in females. Yes, I am talking about breast cancer. According to a survey report, it has already affected 23% of the total health population, among which 14% female die only due to breast cancer. This has become a great concern to the healthcare system around the world. The known treatment for this disease is said to be surgery and chemotherapy, but in majority of the cases, it has been seen that the disease migrates from one organ to other and bones even, leading to the death of the patient. But here we would discuss about its homeopathic treatment procedure. Let's have a look at its risk factor, which are summarized as below. So first is early menarche. It means the female who experience early start of their menses are likely to have breast cancer in future. Next is late menopause. This is also a risk factor. Third is obesity. Fourth is nullipara. This means female who do not have any kids after marriage. Next is family history of breast cancer. This is an alarming factor, and it has been seen that if there is a family history of breast cancer, the patient can have breast cancer, or the female whose mother or affected, they can have breast cancer. Next is female who consume too much of animal protein. Now let's talk about its symptoms. What symptoms do they throw up? So first is swelling, which can be experienced at any part of the breast, irrespective of having any tumor or not. Second is skin dimpling or color changing, looking like orange peel. Third is pain in breast or nipples or both. Next is inverted nipples. Next is the abnormal discharge from nipples, which is not milk. Sixth and the last, swelling of lymph nodes at neck region or armpits. This is to be considered actual reliable sign of breast cancer, even if you are having a very tiny tumor on breast, which you cannot even feel with hands. So the symptoms are, I am summarizing once more: swelling, skin dimpling, pain in breast, inverted nipples, abnormal discharge from nipples, and swelling of the lymph nodes. Okay, so let's move on to the next chapter. It's about the stages of breast cancer. So first stage is stage 0 or the initial stage. Second is stage 1 or 2. Third stage includes stage 3A, 3B or 3C. Fourth stage or the last stage, let me say, in this stage the disease has metastasis to bone, lungs and other organs and is considered to be the last stage. And at this stage it is very difficult for the patient to recover. Patient usually die at this stage. Now in order to confirm the breast cancer, we need to do some investigation test, which will be suggested by a healthcare provider. I am summarizing those as follows. First test that needs to be done is mammography. Second is ultrasonography of the breast. Third is MRI. Fourth is breast biopsy. Fifth is FNA biopsy. And sixth is stereotactic USG guided core biopsy. Either any one of them or all of them is required by a surgeon or your healthcare provider to confirm that you are having breast cancer, and the treatment will follow thereafter accordingly. So friends, up till now we have discussed about the disease, its risk factor, its stages, its symptoms, and how to detect breast cancer. So now we move on about the treatment, the main part of our video. So let's start. So first available treatment is the conventional treatment, which includes surgery, chemotherapy or radiation. Second treatment is through homeopathic medicine, which are safe and effective. And we will be discussing about these homeopathic medicines in details a bit. As you know, there are several medicines which work on such cases, but we will discuss only those homeopathic medicine which work best in clinical practice. Now I am going to share some tips, some homeopathic medicine, the tips with you people. So please note it down. The first medicine which comes here is arsenic album 200, and this is especially used for pain, to minimize the pain, to lessen down the pain, though the pain is very much exaggerated. It is of extreme kind. So arsenic is the medicine in that case. Second medicine is arsenic iodatum 3x, and this needs to be given when the affected area becomes ulcerated, right? Okay. The next medicine is carcinosin 200, especially when the left breast is affected. Carcinosin 200 when the left breast is affected. The next medicine we talk about is symphytum tincture or Q, when the causative factor is injury. Yes, it has been seen that some old untreated cases of injury on the breast later develop into cancer at old age. So the medicine here which we will be giving is symphytum tincture, right? The next medicine which comes into play is sorinum 200, which needs to be given for open ulcer. When the ulcer has burst or open, it is discharging blood or foul smell, offensive material, right? So the medicine is sorinum that needs to be given. Yes, friends, apart from that, there are several other medicines which also work very well. So I name those medicines. First is carboanimalis 200, phytolacca 200, antimonium crude 200, thuja 200, asteria rubens 200, conium 30, euphobium 200. So these medicines also work very well. I have shared these homeopathic medicines with you people for your information and knowledge purpose, right? But the actual treatment of this particular case needs to be done under the supervision of a healthcare provider. I think I have covered all the points regarding breast cancer in this video. Now friends, we have reached the last part of the video and it's time to say goodbye. If you have any question, inbox me or email me at dr.amardweppliv@yahoo.com. If you like the video, please give a thumbs up and subscribe the video. Thank you. Have a nice day. Bye-bye.